I think it's important to still say that the vaccines work, and we should not be saying the vaccines don't work. That's why I want to talk about vaccinating the unvaccinated people. Out of over 800 people who got exposed to SARS-CoV-2, there were 3 hospitalizations and they got released quickly. There were no deaths. This is an amazingly effective vaccine at preventing severe disease, hospitalizations, and deaths. That was actually the promise of the vaccines. It was always why we designed the vaccines. Otherwise, there would not have been a design of a vaccine against something that did not cause severe disease. So I want us to remember the message of this outbreak. The second thing that we learned from this outbreak is that the Delta variant is very transmissible and that it has high viral loads. And what that will do is that it can lead an vaccinated person, even before their B cells, what are we called memory B cells, produce the antibodies that get into their nose to stop that infection, that can cause more mild symptomatic breakthroughs. And because of that, the CDC's recommendation in areas of high circulating virus to wear masks indoors, even for the vaccinated, is very reasonable, because this will prevent the vaccinated from getting mild breakthrough infections. But the third thing from that report that is very important is we cannot conclude that vaccinated people are equally as likely to transmit as unvaccinated people. This was based on what are called cycle-threshold tests of PCR values, but they have not done culture tests, they have not done serial viral loads. Presumably what's going to happen is a vaccinated person is going to fight that virus, bring it down in their nose. So any conclusion from this that vaccinated people are equally as contagious should not be made. So I really want to put that report in context. These vaccines are still working. They do work, but for right now, because the Delta variant is transmissible, putting back masks for the vaccinated indoors is very prudent. Vaccine mandates have been opposed in this country because it seems to speak against people's right, they say, to control their own healthcare. However, this is a public health issue. And what happened in 1905 is that, and I really want to stress this, is that there is a ruling from the Supreme Court of the United States that vaccines can be compulsory. Why? Because there was a smallpox epidemic in the United States in 1905, and 30% of eligible vaccinees did not take the vaccine. So there was a case called Jacobson versus Massachusetts that was presented to the Supreme Court. And there is a Supreme Court ruling in the United States that it is legal and ethical to mandate vaccines for public health crises. You are now seeing the effects of that ruling. You are seeing that state employees in California are being asked to vaccinate or have repeat testing. President Biden will be announcing that and has already indicated this today for federal employees. Third is public-facing employees are mandated to be vaccinated in San Francisco and New York City and in Santa Clara and increasing cities around the world, around the country. Number 4 is that we are mandating vaccinations for healthcare workers in most settings. And that is any healthcare worker should be vaccinated against this virus.